Opioids are analgesics that bind to receptors throughout the body, not just in the central nervous system. They are known to provide multiple analgesic benefits, but these are offset by bothersome and dangerous adverse effects. It is important to bear in mind that opioids bind and work differently in each patient because of receptor variation, but established principles will help to guide the healthcare professional in prescribing opioids. Opioid analgesics have the following indications for pain management. Pain must be severe enough to require daily around-the-clock or long-term analgesia, for which non-opioid alternatives are inadequate. Prescribing opioid analgesics requires attention to their general precautions, including the risks of misuse, overdose, and death, which is typically attributable to respiratory depression, a natural phenomenon associated with opioids. Risk management is achievable through provisions such as consultation with state prescription drug monitoring programs and the use of urine drug testing. Because of the nature of chronic pain and complex interplay among a multitude of medical, psychological, and social factors, it is of paramount importance to clearly define which of these factors are most important in the treatment of patients with chronic pain. Furthermore, clinicians should keenly understand the categories of opioids, potential outcomes, routes of administration for abuse, and diagnostic criteria for identifying opioid use disorders, or OUDs. Although prescription drug monitoring programs have been effective in quickly identifying patients who are doctor shopping, other strategies are needed to address the problem of opioid misuse and abuse. To that end, the Federal Drug Administration, FDA, has promoted the development of opioids with abuse-deterrent properties. An abuse-deterrent formulation is intended to interfere with extraction of the active drug from the tablet, making a change to the drug's delivery system challenging, if not impossible. The prescription drug crisis does not have a single simple solution. It is important to remember that abuse-deterrent formulations are just one tool that prescribers have at their disposal to address the prescription opioid epidemic. Other tools include prescription guidelines, continued research for newer and safer therapies, education of both physicians and patients about the safe use of these products, insurance reform, and provisions such as urine drug testing and prescription drug monitoring programs. Important questions related to therapeutic considerations can assist healthcare professionals in setting priorities when treating pain. By adhering to the identified principles of responsible opioid prescribing, healthcare professionals can ensure due diligence and the proper positioning of opioid therapy for chronic pain. This includes establishing a diagnosis and developing an opioid treatment plan, as well as a thorough consideration of non-opioid modes for treatment of pain. Informed consent and a treatment agreement setting very clear boundaries are also essential to prescribing opioid therapies. And lastly, there needs to be a roadmap for discontinuing opioid use if a patient is not complying with the therapy agreement.